Hi, I'm Annemarie Cardell. I am a ER doctor in Brooklyn, New York, and currently 30 weeks pregnant as of yesterday.
How are you feeling? Like, what does that feel like in your body right now?
Oh, big? No, I don't know. I think it's a weird place to be pregnant right now in healthcare. People want to protect you because we have no clue what the risk is to the baby. But I feel very obligated to be there. That's my job. That's what I signed up for. And it feels like there's a battleground that's like that we can fight. And I can't be there on the front lines because I have to protect this thing that's inside me. And I don't even know what the risk is to it.
Talk about what your day looks like, and how much of it is kind of normal and how much of it is completely abnormal.
I think getting ready for shifts, going to shifts, everything's changed just like little bits. I no longer do my hair and makeup. Because I don't have a full face at work. I have to cover it all with the mask, and then you get the makeup on the mask, and that's a pain. I've started wearing scrub caps to work to try to avoid some of the washable scrub caps because the hair nets we're probably going to run out of because everything we're going to run out of. I only wear scrubs. I don't wear professional clothes anymore, and everything's kind of just switched over to be like you wear it to work, you come home, you wash it, or it never comes in the house. Um, and then as far as work goes, that's just a completely different game every day. We have new protocols. We're moving patients around in different ways, trying to maximize the space that we have for a different patient population than we've ever had before. Because we're admitting now, almost a third to 40% of our patients, and we used to admit like 10 to 15. So everybody's sicker, and trying to recalibrate our space in real time to adjust to this type of sickness has changed everything from shift flow to volume to procedures that we do and where we do them.
And talk a little bit about, a lot of people don't realize like the protections that you have. Like, what does it feel like on your body giving, being a doctor, but also a pregnant person kind of in PPE?
Mostly uncomfortable and hot. It's 2 masks is what we wear. So I've now accepted the fact that I can't walk in the ER without a mask on. And you keep it in like a paper bag between shifts because paper is actually like the virus would die faster on paper than it would on plastic. Which is why we choose paper bags, not because we're cheap, because like it's actually a little bit better. And then I wear just my glasses because I can't wear the goggles, they fog up. Some people wear the goggles all shift, and then you wear a hairnet, and then you come to work in scrubs that are like a one-time use that are going to be washed right as soon as I get home, but I cover that with a gown. And after all of that, then you can go see patients, like once you're completely covered. So no longer is it like they can't hear me, they can't see me talking to them. And that's changed a lot. The whole idea of therapeutic touch and all the micro expressions that we have in our face. Like I can't see my patients because they're wearing a mask, and they can't see mine because I'm wearing a mask. And I'm no longer tapping my colleague on the shoulder to get their attention as much as I used to, or holding the patient's hand as much as I used to, because it feels like you have to minimize all those points of contact because this virus is so spreadable. It's so easy to get between people, and just a little bit in somebody who's immunocompromised is dangerous. And I know I could easily be spreading it to them, and I have to be careful of that too. Does that make sense?
Yeah.
So yeah.
That idea of therapeutic touch being gone, it really like resonates with me that is something that I think a lot of people need right now.
Yeah. And especially because they have no family. It's so sad when you have these demented old people, or even just anybody that has a little bit of memory problems that's stuck there in this ER bays of stretchers. Somebody's yelling because somebody's dementia is worse than theirs, and nobody knows what's going on. And if you can't hear all that well, losing all of that ability to read lips makes it harder for our elderly population in particular. I feel it's hard for their families to advocate for them over the phone. Some are really, really good at it, but we're not set up and we're not used to having phone conversations to get our histories. We're used to talking to people at the bedside when we're examining the patient. And that's all gone, especially for that patient population. And I think we're all starting to have the moments where we realize that somebody is sick, very, very sick, and trying to get their family in there comes with a risk. And while we can, if their family member is also sick from something or immunocompromised, then we feel obligated not to, because we feel obligated not to risk them, because we know how spreadable this virus is, and we know we can't isolate everybody that has it. They're all in one big room with a bunch of HEPA filters running in hopes that that catches most of the virus. But if we have a dying 90-year-old sitting there and the safest thing to do is FaceTime and she can't hear it well, it's just horrible. It's not what you want. You want their family there holding their hand. And we don't get that anymore, and they don't get that. And I think it's hard for providers. It's really hard for families. And it's totally changed how people die in hospitals. Because it used to be we tried to get the family there. You tried to get all of their loved ones there. So this could be a comforting experience. And it's just so much more clinical than it's ever been before.
I feel like that's a good point to transition to what's been happening in New York City in the last couple of weeks. This idea that limiting partners to all patients in a hospital, but particularly to birth patients and people. Talk about what it felt like to know that it was going that way as a pregnant person, but also as a doctor who understands why you want to minimize the risk.
I can see, I think it was hard for me because we live in a household, there's two types of providers in this whole mess of healthcare. I think there's the providers that are like, I will separate myself from my family. I don't want them to have the risk of coronavirus, but you have to completely separate yourself. It's not just like, and you have to sleep in a separate room. You have to shower as soon as you get in the house. My husband's healthy. I'm healthy. We have no children at home. We have no risk factors. And I know I was in contact with coronavirus way before we knew what was going on. And I knew I was exposed. So I just assume he's exposed. So I'm not trying to protect him from me. Like, we're still sleeping in the same bed. We have a 800 square foot apartment. Like, where am I going to go? This thing is airborne for 3 hours at a time. Like, we can't share the same space and him not be exposed to the same things I'm exposed to. I can take off all my clothes and shower when I get home and try to get as much off of me, but like, that's not 100%. And so I'm in the bucket of already sharing germs with my husband. And so when you're talking about going to a hospital together to give birth, it's like, well, we're already coated in the same germs. We already are carrying the same germs. This is a disease that's so transmissible. If I have it, he's going to likely be able to carry it, and vice versa. So one spouse coming in without the other, like, it's not like there's a whole new set of triggers that they're coming from. They're coming from the same household. So from an exposure of what they bring to the hospital, I didn't understand that. From a PPE limitation, that I do understand, is they want everybody to be in a mask, and we are running out of masks. But we're talking about like a 1% of the hospital population kind of number. And I think there are ways to limit the exposure of the partner, because if you have two people moving around, you clearly have two sources of touching things and exposure. And so limiting the partner to stay in their partner's room, and like avoiding movements in the hallway, and avoiding pregnant people walking in the hallway, but walk in your room more. Like, I get those kind of things to try to minimize exposures. I think it's really hard for me to understand why I would need to labor without him. And I think part of that's because I've been with laboring women. I've caught enough babies to know our nurses have too many patients to nurse those patients while they're laboring appropriately. They can't provide ice chips. They don't have time to go get water. They don't have time to help them get up and down to the toilet. And so all of those little movements that you have to do that are really hard to do 9 months pregnant in labor, you need a person to help you with them. And the nurse can't, if the nurse is that person, then your C-section rates go up, your complication rates go up, pain's gonna get worse, which means you're using more pain meds, which means that delays birth a little bit. So it's like, I understand there's also all these complications related to birthing, related to not having that partner there. And I think it's hard as a provider to know this is a riskier situation for me to give birth in. And I also am not totally on board with it saving that much risk for coronavirus in the hospital and PPE. Does that make sense?
Absolutely. And that's, I think, what a lot of people were saying. And I'm glad to know that there's a new directive from the state.
Me too. I'm also scared of birth.
Yeah.
I expect it, well, heard it, it'll take forever. So.
Yeah, let's talk about that. I mean, what is, how were you feeling about giving birth before this? And like, how has it changed maybe your anxiety or your kind of mental image of what it could look like?
I mean, I think before this, you were in that stage of planning for, my friend was going to throw me a baby shower next month in New York, and the baby's room was coming together, and we were literally right as coronavirus hit. I think I was redesigning like where the storage was going to go and all of those things that you do to prep all the, like, whatever they call it.
Nesting.
Yes, all the nesting. I have not wanted to nest since coronavirus came. I want to get out a healthy baby, and I'm very happy when it kicks, and I'm very happy that that could happen. But there's so much more fear related to getting a healthy baby out in this hospital system during a pandemic is dangerous. It's just all of a sudden this is a high risk thing. And going to a hospital that may or may not have ICU beds, that may or may not have vents, that may or may not have medications in stock and resources if I get sick. And as somebody who understands the complication rate of delivery, and as a 35-year-old woman who's slightly higher risk, but otherwise normally pretty healthy, I know I most likely don't need all those things. But I wanted them, and I chose to give birth in a hospital with a NICU because I wanted all of those things. And now New York may not be able to provide that. And so we've had a lot of conversations of, well, depending on when the peak hits and how bad the peak is, we know the numbers for our hospital. If our hospital is at 4 times capacity, I should not be delivering there. I should not be delivering at any hospital that's operating at 4 times capacity. While OB is being protected as a specialty because we have to have them functioning, we have to keep being able to birth babies, and babies will come out no matter whether there's coronavirus or not. It's just like appendicitis will still happen, and people with congestive heart failure will still go into fluid overload. Like, all of these things need to still be able to happen. But when you are the minority during this pandemic of everybody's in respiratory failure, care will change. It won't be as ideal as we want it to be. And so we keep debating. We just don't know if it's going to be safer just to leave the city to give birth. And we're lucky that we have support systems other places, and we have the money and the means to be able to leave. But I'm sitting here watching New York become the epicenter of something that's destroying our healthcare resources. And I just don't know that we don't need to try to get people out of the city as much as possible to just stem the mass volume that we can't take care of.
Yeah, that's legit. I'm a mom, and I thought about, what if Laura falls and breaks her arm on the scooter when we go around the block? All of those things that you have to think about as a mother to a tiny person.
Yeah.
How do you?
They love to fall.
Yeah. So when would you make that call? You know, how many, you said 30 something weeks. What does that look like in the kind of planning for
I
birth?
think where we're at right now is we have family in Atlanta, and in the suburbs of Atlanta, they quarantined very, very early. So they're likely to get hit a little less. I think suburbs in general will likely ride through this okay because they mostly have enough money to quarantine early, and they were fearful enough of coronavirus to quarantine early. And so from the people that I know and what I'm seeing, those communities will probably get through this a little bit safer. So if we have time and I'm able to take a couple weeks off before, or the baby's not coming yet, we may just drive down there. Or if the city's horrible and my husband's still working, not working remotely, but still is going back to work, and the city hospitals are bad, we may drive out to Long Island or go up to Connecticut.
Yeah.
Insurance has to do with that. And so we have to start working with them and trying to figure out where is possible. And then trying to find an OB, even as a doctor, trying to find an OB who's like, oh, I did not see you your entire pregnancy, and now I'm just going to deliver you, is not something they're used to seeing either. That's not typical.
Well, I'm glad that you have the means and the freedom of movement. I think a lot of people don't have that right now. And so I'm glad for that, for a lot of people that do have, that. What is like going into this week? I mean, what does that look like for you in terms of taking care of your body while working? You know, there are certain demands on your body when you're a pregnant person, whether that's like using the bathroom because your bladder's small, all of those things. What does that look like in the next couple weeks for you?
Yeah, it's, I have to take off my mask more during shift when I sit down. So it's kind of, there's a couple of things that change. One is I don't work on the acute side. So we've divided our ER into all the sick COVIDs and then all the everybody else, which is still like 80-90% COVID. And then all the appendicitis and everything else that's not a dying respiratory patient, because 80% of what we're seeing is respiratory patients. So we tried to cohort them in that way. And my hospital was really lovely in that we tried to get all the pregnant women out of the area where most of the respiratory risk is. And if you look at provider risk, the largest risks come from CPR on these patients and intubations. And so I'm not doing that. But on the side where I'm working, I sit kind of at one of the desks that's farther back, that's farther from the patients, because I can't breathe very well with the diaphragm up here and the masks on. And so I have to take them off during shift to catch my breath sometimes. And I still have to keep water at the desk because otherwise it gets really crampy and I start having bad belly pain. And then you worry that you're going to go into preterm labor because you're dehydrating yourself. But every time I take that mask off, I know it's not the safest thing I could do. I should leave it on as much as I can. I just literally cannot get through shift without drinking some water, or taking it off to breathe. And so I just try to protect myself in other ways. As far as bathroom goes, you just have to take all of the stuff off. And every time you take it off, it's like you're at risk for just contaminating yourself again. And that's just how it works. I still have to pee in the middle of a shift. There's no way I can make it a whole shift anymore. But I've tried I eat less on shift than I used to. I don't snack like I used to. And for the most part, I've been able to tolerate that, and that's been good.
Well, I want to extend gratitude to you for continuing to work through this and help the community. This is such a really hard time, and a lot of people are not really seeing the impacts on you as a person, psychologically, physically. And I think the more that we could do to share that is important.
Yeah. Yeah, it's definitely, it's gotten to the point where I'm not sleeping. Probably mostly because of this. So some of it could be third trimester, but yeah, I'm waking up every couple hours, probably 4 to 6 times a night on average. And every time I wake up, it's a COVID something in my head, whether it's like one night it was respirators, one night it was PPE. Last night I kept waking up thinking I was admitted to the hospital and they had to intubate me when we wouldn't intubate me. This is what doctors go through in the middle of the night. Your brain like can't process. And so in my brain, I'm going through this procedure that I wouldn't have to go through if I wasn't pregnant. Because we're gonna, if and when we find pregnant women with this disease, you have to treat them differently than permissive hypoxia, which is what we do for everybody else, because there's a baby that needs the oxygen and we have no clue if the baby's getting oxygen. So if I was sick, I know I would be treated differently than everybody else who's sick, because all the protocols we're using, you have to balance these two things. And so anyway, that was just running through my head the entire night. So it's not as exhausting for some reason to only get 2 hours of sleep at a time, but I'm not the nicest spouse, and it's wearing on me because it's been weeks since I've slept for more than 4 hours.
What are the sources of strength, and what are the what keeps you motivated when you get up every morning and go and tackle this? What does that look like?
Yeah, I think there's been a big outreach from the just social media, from friends and people that thank you for doing your job, and that feels weird, but really normally you don't get thanked. Normally you get a thank you like a month as a doctor, and that's like, oh, it means a lot, because nobody ever thanks you for what you do. And so that's helpful. It actually is really helpful to feel somebody appreciates what I'm doing, even when the patients are yelling at me for discharging them with their flu and fine. They just don't want to go home. I think having a supportive spouse, having somebody who doesn't ask me to stay home, that knows that I can't because I can't not go to work and not participate in this thing that's decimating my specialty. I just feel obligated to be there. Having somebody who is willing to go through the literature and understand why the risk profile for me going to work is actually probably lower than we think it is, and probably okay, we just don't have enough data to know for sure. Having dogs at home, honestly, they just are completely oblivious to coronavirus, so they just love you the same way, and you have this little cuddle bug that you can come home to that doesn't ask questions. It just wants to be with you, and that's helpful. You need a warm body to snuggle that can share your germs. It doesn't have coronavirus, because it's not like you can hug anybody at work or shake hands with people anymore. So you got to get that contact somewhere. And I think it's been very good to have a supportive spouse and the dogs at home. We're trying.
You're doing your best.
Yeah.
It's all we can do right now, right?
Exactly. And I think there's this team-based atmosphere to it, especially working in medicine, it's kind of just like any other team. You tackle these things together, and having those teammates that you go to work with and you work alongside, and knowing that we've all tried to be a little bit more protective of each other through all of this. And you need that. You need that support network to say, this is weird. We're doing things that are riskier than we've ever done before. And we just have to support each other and try to remind each other how to, when I take my mask off, people yell at me. They know I can't breathe in it, but they yell at me, and that's good. And I want them to continue yelling at me so that I put it back on. But that team atmosphere it's an up to notch from where it used to be, and that's nice and helpful.
I feel like that's a nice way to end, on a team, like uplifting note. I really appreciate you sharing and the work that you're doing. And yeah, I'm going to thank you for doing your job.
Well, thanks.
It's a weird thing, right? Yeah, to just do what
Weird.
you do, but this is a time where it's all the more important.
Yeah, it is.
So,
But thank you for doing what you're doing. I think we have to figure out a way to get people, like the stories of the ER, out there. Because while I see this like every day when I go to work, and I see the horror of coding young people and dying young people, and the fact that every hospital in the city is running out of space in their morgues, it's palpable that people are dying at rates they've never died before in the city. And you can't share that with just still images. Like, you can't express what that feels like with pictures of trailers. It's not the same. And while I don't want everybody to go experience it firsthand, I do want them to at least get a grasp of what's going on and why it's so important to stay home and why that actually helps. And I think you getting people's stories out there in a way that they can relate to is super helpful. So thank you.
so that's what I know how to do. Just, I think in the same kind of way, you go to work, you do what you do.